Hello, I'm Dr. Gary Huber, and this is my colleague, Chelsea Dorsett. We want to talk to you about corporate health. Yeah, boring, right? Corporate health initiatives, if you think they're a waste of time, you're not alone. We think they're a waste of time too. That's why we changed it. We turned it upside down. The old model doesn't work. Just identifying that George has high blood pressure and putting him on medicine, it doesn't make George healthy. That's what we're about. We want to come in and actually make your employees healthier. And I know your first question is, what's it going to cost and what's the bottom line? I want to talk about return on investment because that's really critical. So, return on investment.
The biggest thing you'll notice is the prescription costs decrease significantly.
How is that possible?
How's that possible? We're not even acting as their primary care physician, but when you get healthy, when you change the physiology, the need for blood pressure medication or metformin, that all goes away and decreases significantly.
So for those that are wanting and willing to make change, bam, we hit them with our 6-month program, and we engage them weekly accountability, education, outside the office events to change their lifestyle. And when they change their lifestyle, all of a sudden their blood pressure, their heart rate, their blood sugar, their CRP all goes down. And when that goes down, your need for medication begins to evaporate.
Absolutely.
How much money do we see typically in a 6-month engagement? How much reduction in medication costs?
On average, the last group we did about $1,000 per month. And that was
$1,000
a
a month.
group of 14 people. So that's pretty significant.
It's not uncommon in a group of 14, 15, or even 20 people to see 10, 12, 15 prescriptions go out the back door. That's a direct savings in cost. What kind of labs do we measure?
We do in-depth labs. So if you're just looking at, for example, a fasting glucose, you could miss 50% of your diabetics.
What about weight loss?
Typically on average about 30 pounds in that 6 months, but we go into this program saying this isn't a weight loss program, it's a side effect, right? It will happen surely, but we get patients who are skinny diabetics and they're coming to get off their insulin. So it's not just take every overweight person in the company. It's really about a health program.
And it's not caloric restriction weight loss.
No.
It's getting them healthy. We do not put anybody on a caloric restricted diet, but we show them what to eat and what not to eat.
Yes.
And I'll tell you what, it's infectious when people start feeling good. It just expands.
Absolutely.
So, definite return on investment.
I know what you're thinking, dietitian, she's gonna tell me to stop eating calories and work out much harder. Couldn't be further from the truth. I am gonna blow the lid off of this thing and show you that it is so much deeper than calories in versus calories out. We're gonna look at your physiology together, we're gonna look at labs, we're gonna explore your gut health, and you will find this is so much deeper than just calories in versus calories out. It's more about whole foods and less about portion control.
Dr. Huber and Chelsea are teaching the right program, and I can tell you our success and we're changing lives, we're changing families, we're changing it all. And it has just blown me away watching the results because I came out of that standard health care.
One of the most powerful things we do inside of a corporate health engagement is we create a group. We select a subset of patients with metabolic syndrome that are wanting to make change. And I want Chelsea to address why is working with the group so different than most corporate health initiatives, and why is it so powerful?
Oh my gosh, and don't get me wrong, I love working with patients one-on-one, but about 5 years ago when we started doing these small groups, 12, 15 people, it was magical. I mean, it was something I never anticipated, seeing these groups come together, and there's a strength in numbers. There's a strength when 3 people are doing well, everybody else wants to do well. So it's something that you cannot recreate one-on-one, and it is, like I said, the only way I can describe it is it's magical. It's powerful.
Well, it sends a ripple through the company, and all of a sudden this small group is affecting a bigger group and a bigger group. And it's like if you've ever worked out with a group of people versus a solo workout, there's an intensity inside of a group. And when you get that mindset, that pack mentality, it's amazing the change it creates.
Yes, I think you nailed it. It's that Pac-Man mentality. And on the flip side, if you're not doing well, you're looking around you saying, oh crap, everybody else is doing well but me. So it's unbelievable. It's amazing.
All right.
The combination of the knowledge that I've gained, the excitement with which Dr. Huber and Chelsea have taught us, I think have been really important for me and have been impactful.
My kids are still working on, getting that sugar out of their system as well, but I can see a change in their lifestyles already just because of the changes that I've made in what we have in the house versus what we had in the house before. So hopefully I'm planting those seeds with them so that they can have a much healthier lifestyle as well.
So you got to be asking yourself, well, what is this magic program you have, Dr. Huber? It's called our Virtuoso Wellness Program, right? It's a 6-month engagement. We're going to pre-select metabolic syndrome patients. And what are we going to do with those folks for 6 months?
So I'm going to be on your campus, on site, every single week for the first 3 months, and then every other week for the 3 months after that.
So a lot of accountability.
A lot of accountability. We do weigh in. We do a presentation. You can call it a lunch and learn, but it more, again, is that group dynamic. We are talking, we are working together as a team.
Well, and it's way beyond a lunch and learn because it isn't just some random topic. There is a curriculum. There is a building, growing curriculum, and they're going to walk away with a book and a recipe book and a lot of tools to educate them.
Absolutely.
Right? And we're going to do things that are outside the office.
Yep. We do grocery store tours, which is my favorite. So we actually, all of us will meet at a local grocery store. I walk through the aisles and I actually show them how to put a meal together, how to read a food label.
And you think you know how to buy groceries? You don't, right? So we're going to help with that. We're going to do a cooking demo.
Yes, a cooking demonstration, because again, I can't just sit in an office and say, oh yeah, go buy this and cook this and put it together. I need to show you how to do it. So we are going to actually get our hands dirty and cook together, which is really fun.
And we're going to change your being. We're going to change the way you think. We're going to change the way you process. We're going to really challenge your belief system. We're going to do our mind-body mission, which is several engagements where we dig into why do you make the decisions you make, and how do you change disabling beliefs that you own and install more empowering beliefs for actual change, right?
Yeah.
All that in a 6-month program, and it's amazing. These folks, the effect ripples into their family, it ripples into cubicle mates or office mates, and that's what we're trying to create. A changing culture, the proverbial pebble in the pond ripple effect throughout your company.
The results have been amazing. I mean, we take groups, and those 10 people have friends, they have co-workers. So all the results that are happening, all the changes in these people's lives, it's just like waves in a pond. We're in the hundreds of thousands of dollars of savings of people coming off of medications. Our whole company has gotten behind this, and they really like it, and they're interested. 350 people came to hear his last lunch and learn that we had. So they're interested, we've got them rolling, and they want a piece of it.
You got to be ready to engage by now. So if you want to reach out to us, have a conversation about how we can affect your corporate culture and your corporate health. Chelsea, how do they reach us?
You can give us a call at 513-924-5300, or you can email us at help, HELP, at huberpm.com.
Let's sit down with your Chief Financial Officer who would love to talk to us, your human resources person. Let's figure out what we can do to make your company the healthiest in the city. Take care.